I'm Tony Bova, and I am a nursing student here at Wilson State College, and today I'm going to be doing my central line skills. We're going to be performing a dressing change, we're going to be drawing blood out from the central line, and we're also going to be giving medication through the central line today. So first things first is I'm going to go ahead, I'm going to check my provider's orders with my my MAR, and so we're going to double check, and we're giving Chester Chest, date of birth 7/19/19. He has an allergy to codeine. And so our orders say we're going to be giving all IV medications through the central line using the port for all blood draws, and we're going to be doing a central line dressing every 7 days in PRN, and he is due today for 7 days. And we're also be giving ceftriaxone 1 gram IV push every 8 hours, and on the MAR it says ceftriaxone 1 gram IV push every 8 hours. And then we're also going to be doing a lab, CBC, and CMP now. And then we're going to be converting the IV to saline lock, flushing the central line with heparin now. And we also have on the MAR a heparin flush 5 mils 1 time. And so everything matches here. And so then we go to our medication room, and we're going to grab all of our supplies and get our medications. And so I have pulled my medications from the Pyxis, and I'm double checking. We have a heparin flush, we have 5 mil syringe, and that is what it says on here, heparin IV flush 5 mils 1 time. And then we have ceftriaxone 1 gram IV push and 1 gram IV push. And so we have those, and that's our first check for med checks. And so I'm going to go ahead and I'm going to go to my patient's room with all of my supplies, and I'm going to do hand hygiene prior to doing this, and then I'm going to go to my patient's room with my MAR. So knock, knock, knock. Hi Chester, I was just wondering, or just coming into your room to check on you, see how you're doing with your central line. And today the doctor has ordered a dressing change for you, and we're also going to draw some blood, and we're going to give you some antibiotics and send you on your way home today, okay? Can I have you verify your name and date of birth? Chester Chest, 7/19/19, perfect. And you have an allergy to codeine. Okay, nothing's going to affect the medications given today, because allergy to codeine is not with anything else, or gonna affect with anything else. And so first things first is I'm gonna go ahead and do my hand hygiene, and then I'm going to put on some gloves. And we're going to go ahead and cleanse the port. All right, and we're going to make sure to get the hub and the top, and we're going to cleanse for 15 seconds. And prior to doing this, if the port was hooked up to an IV, we would actually unhook it and let it sit for 10 minutes prior to doing anything with the central line. And then we're going to open our flush. Air out. Okay. Connect. Open the line. We're going to aspirate for blood. I see blood in the line, and now we're going to go ahead and we're going to use a pulsatile flushing method, and we're just going to do 1 to 2 mils at a time and flush. And everything's going well. There's no swelling, redness, no drainage from the site. And then we're going to close and twist that. We're not going to close that. We're going to get the blood first in this one so we can get rid of the first 10 mils. And so I pulled 10 mils of blood, close, and then unhook, and that would just be discarded. And then we'd get a fresh sterile 10 milliliter syringe. We would attach that, open, and we're going to take 10 milliliters of blood out. Close. And then we'd give that to the phlebotomist or the med tech, and that would go to the lab. And then we're gonna go ahead and we're going to flush this again. Take the air out. Connect. Open. Pulsatile flush. Close. And take that off again. And now I'm gonna get rid of all my mess. Into the garbage. I would take my gloves off, and I would also, I'll document at the end when I'm all done with everything, but I would do hand hygiene after that. And now what I'm going to do is I'm going to do a dressing change. And Chester, I just wanted to explain the procedure to you. We're just gonna do a dressing change, and we're gonna check everything, making sure everything is good to go, okay? Perfect. And so assessing the site, I see it's time for the change. There's no pus or drainage on the site. There is no swelling or redness or erythema. Everything seems good, and Chester's not having any pain or anything wrong with it. And so what we're gonna do is we're gonna go ahead and we're going to open our sterile package ever so carefully. And I'm going to hand hygiene, new gloves if I didn't already say that prior to doing this. I'm going to take the mask off of this, and I'm going to hand this to my patient, have them put it on, and then I'm going to have Chester move his head towards me. And so the next thing I want to do is I'm going to start taking the dressing off, and we're going to make sure that we are pulling to a point to where away from the dressing so that we don't pull any of the line out. And this stuff is really, really sticky. And when we take the dressing off, we're also going to be taking off the antimicrobial patch. Perfect. And the dressing looks okay. There's no drainage on it or anything. So then we're gonna get rid of the dressing and the gloves. Hands get sweaty in gloves. Okay, and then everything looks good. We're gonna go ahead and measure that prior to getting everything cleansed, and it looks like everything is in the same position, so we'll be good to go with that. And so our next thing we're gonna do is we're gonna do hand hygiene again, and I'm going to go ahead and don sterile gloves. Perfect. And so I'm going to go ahead and I'm going to put my dominant hand on first. fix the rest after we get this glove on. And then we're going to go ahead and get the other glove on. Perfect. And now we can just take this and it would go onto the floor or into the garbage. Next, what we're going to do is we're going to grab this and we're going to go ahead and stick that here. And in just a minute, I'll grab the line and we're going to hold that with this glove, and it's going to be my non-sterile hand, and I'm going to keep this hand sterile at the same time. So first things first is we're going to want to cleanse. And so we need to cleanse. And now I'm going to make this hand not sterile, and we're going to go ahead and cleanse around the site, keeping this hand sterile. There we go. And we're going to go in a circular motion around 2 or 3 times, just getting it nice and clean. And this would go in the garbage. And then we're going to get any of the crusties off around the insertion site. Garbage as well. And then we're going to go ahead and we're going to grab the tweezers and the gauze, and we're just going to clean it or dry it up ever so nicely, making sure that it's nice and dry so we can apply our dressing. Perfect. That's garbage. And then we're going to grab our antimicrobial patch with our sterile hand, and we're going to apply that right underneath, just as so. And then we're going to lay this down on our sterile field. Go ahead and open that up. Perfect. And then we'd write our initials, date, and time on here. And place that right there. And then I'm going to go ahead and get a piece of tape and make sure we coil up this part so it's not hanging all over the place. And then we can get rid of all the rest of our supplies. Take off our gloves. And we can do hand hygiene after that. And so the very last thing that we're going to do, clean up all my mess, is we're going to give our antibiotic through the central line. And so, I need more gloves. And so what we're going to do is we're going to double check our medications again. We got our heparin flush at 5 mils, and I've double checked with my nurse that we have 5 mils, a secondary check. And then we also have ceftriaxone, 1 gram IV push is 1 gram IV push. Okay, and so then I'm going to do hand hygiene and put on a new set of gloves. All right, and so first things first, I'm actually going to get my flush out and ready. Okay. And then we're going to cleanse our port. Oops. And we'll be doing this for 10 to 15 seconds as well, making sure that the port is nice and clean. And first things first, we'll do a flush. Oops. Oh, and then I dropped it, so I'm gonna do another wipe. And get rid of the air. And we're going to connect, open the line, do the pulsatile flushing. Prior to that, I would have aspirated for blood and made sure it didn't go in the syringe. Okay, and close, disconnect. That goes in the garbage. And then we'd open our ceftriaxone, which is our medication. Gonna connect that. Open the line. And then we would push this over 3 minutes. But for the sake of the video and the time, I'm not going to do it for 3 minutes. So then we're going to close the line, take this off, dispose of that for facility policy. And then we're going to get the air out of this one. We're going to flush it again, connect, open the line, pulsatile flushing. Close the line, and then we're going to do the heparin flush. Connect, open the line, and then we would do the pulsatile flush as well with this, making sure to get all 5 mils in there, so it would be the heparin lock. And then I'm going to close the line, and I'm going to disconnect and dispose of this for facility policy. And I've got all my stuff cleaned up. Take my gloves off, and I'm going to do hand hygiene. I'm going to do my documentation of what time I did my ceftriaxone, what time I did my heparin flush. I'm going to document all of my procedure with what kind of dressing I did for the dressing change, that there was no drainage, no redness, no erythema, the patient was comfortable. I'm also going to document that I did the blood draw, as well as what time I did it and who I gave the blood to. I would clean up all of my stuff and make sure that the patient was comfortable, and I would leave the room.